We've talked a lot about the importance of flattening the COVID-19 curve. But what do we do when the curve now looks anything but flat? We'll explore ways to interpret that data and pull some meaning out of the most recent numbers on this episode of Shareable Science Beyond the Blog. Welcome to Shareable Science. Science you can share. So we're going to start our conversation with this graph, the infamous curve, the number of new cases every day in the United States. And you can see it went up, and then we had this really long plateau and slow decline till about the beginning of June. We dropped around 20,000 new cases a day. And then in the month of June, we've started to climb. And in the last week, we actually crossed over the 40,000 new cases a day, 40,000 new cases of COVID-19 in the United States every day. What do we make of this? Do we panic about this? In order to put this into context, we need to look at some other pieces of data. Let's start with this graph. This is my approximation of the data from the Johns Hopkins COVID-19 Resource Center of the number of COVID-19 tests that are available every day in the United States. And the good news is that there's been a steady increase in the number of tests. We're now offering right around 600,000 tests every single day in this country. And that's spectacular. More people have access to tests. Testing more people, casting a wider net. It's logical that you would be able to detect more individuals that also have COVID-19. So perhaps some of this increase is because we've drawn a broader net. We are testing more people. But in order to get at that relationship, we need to look at one more figure, and that's down here. And that's the percent of positive tests. So of all the tests that are offered in a given day, what percent of those actually come back positive for COVID-19? And you can see it was really high early on. We had a very small number of people that we could test, a small number of tests we could offer, and we were very focused on who got those tests. But then as we moved through May and into June, the percent of positive tests dropped as we offered more and more tests to people. That's what you want to see. You like to see the percent of positives dropping or at least staying level. That tells you that you are getting a handle on the amount of testing. However, in the last couple of weeks, we've actually seen this number creep up again, which would suggest that we are seeing a higher percentage of our tests that are coming back positive. That doesn't have anything to do with how many tests we're offering, but it says in a given population, more people are showing up with the infection. So some of this increase is likely due to a greater spread of the infection within the populations. Now, it's really important to say this is the United States at large. This is all of our aggregate data. You and I care about what's happening in our communities. So you want to look at this certainly at a state level, but realistically even more, you want to see what these numbers look like in your county. And you can do that with your state's public health department database for COVID-19, or you can also dig into county level at the Johns Hopkins site as well. And what you want to be watching for is, are the percent positives level? Are they dropping or are they increasing? And when they're increasing, you have cause to be concerned. There's a couple of other indicators that we can take a look at as well that also tell us something about spread of COVID-19. That's the number of individuals that are hospitalized for COVID-19 and the death rates. So when you see these numbers going up, that's indicative that the virus is spreading more rapidly. The challenge with this is that these are lagging indicators. It may be 2 or 3 weeks from the time someone is exposed before they go into the hospital. So hospitalizations tell you what the virus was doing 2 or 3 weeks ago. And death rates tell you what the virus was doing even longer ago. Now the benefit, the positive in here, is that we've watched the death rates steadily drop over the last 6 to 8 weeks. That's incredibly worth celebrating. That doesn't mean that we don't mourn every single one of those deaths that we see, but the fact that we are seeing less is positive. We'll have to wait to determine if the increases I showed you in cases on the other side actually track for increases here. Some states are already seeing increases in hospitalizations, but not all of them. Again, this is local to you where we have to be making these decisions. Lastly, I want to talk about this really quickly. almost half of the new cases of COVID-19 are actually occurring in individuals under the age of 35. And we've been talking for weeks that the individuals at highest risk are people over the age of 60 and 65. So why are we now seeing so many younger cases? It could be because of differences in testing. Now we are making testing available for people of all ages instead of only offering it for those folks that we were most concerned about early in March and April. So it might just be that we've broadened the type of people coming in for testing. It might also be that the people coming in for testing because they've got symptoms are the individuals that have been in higher exposure situations. So our older population, there's some indication that nationally our older population is hanging back as the country reopens and is not stepping into crowded settings as frequently as the younger population. So it's probably some combination of these two things. I want to be really careful about this last phrase though, because we have said that the hardest hit populations, the highest risk populations, are our older populations, individuals with pre-existing conditions, individuals that are on the front line, and we see higher amounts of cases among our African American and our Hispanic populations as well. I want to be careful that people don't say, oh, well, if most of these cases are young, they don't get sick as badly, and so it's mild, so we don't really have to worry about it. That's what that actually all accounts for. We are seeing in many hospitals a number of young people with pre-existing conditions, with obesity, with diabetes, with cardiovascular disease. So we don't want to say, oh, this is younger people, we don't have to worry about this. There are still significant concerns. And we also were concerned that younger individuals may bring this home to the older population. So we may just be delaying the increase in the older populations. That's why it's really important. I know you're tired of hearing this, but it's really important that we continue to practice physical distancing and that we wear face coverings when we're in situations where we cannot practice social and physical distancing. This is a situation that is continually changing. Every morning, these numbers get updated. Again, you want to look at what's happening in your specific community. If you find this useful, please share this with those around you. Thank you for watching. I look forward to seeing you for our next video. Take care.